So the first practice that we're doing is geared more towards your low back and your hip and your SI. So you want to focus on structural alignment, and we'll do a standing pose where you're just standing and working isometrically so that you start to work some of that misalignment back into place. And we'll be doing poses to increase circulation, which is what we always want to do first so that the muscles will be more agreeable to opening. And then we'll strengthen and stabilize around your SI joint. And we'll also have some poses in the beginning to bring circulation all the way down to your feet. So that should help with your knee and ankle. And I'll give you guidance as we go through this. Okay? Thank you. We'll start with a pose that's a variation of Tadasana. And this is to increase circulation all the way down to your feet. It helps strengthen the ankles, which in turn helps the knees. And the primary intention here is axial extension, so like you're being pulled really tall, lengthening through the crown of your head. You're going to take your feet hip width apart. And then it's key here to stare at the floor about 12 feet in front of you. That will help with your balance. Press through the big toe joint, otherwise your ankles will start to go out to the side. And you're going to come up very slowly and come down very slowly, landing your hands at the same time that your heels land. So you can raise your arms out and up or forward and up, whatever is your preference. Good. Coming down as you exhale. Inhaling, rising up. And you don't have to come up super high. You can come up a few inches or you can come all the way up, whatever serves you. Exhaling down. Beautiful. Then relax with your arms by your sides and just notice the effect of the pose. Okay, we're going to do a standing forward bend to strengthen your back. Feet are hip width apart so you have structural alignment. And I want you to bend your knees generously as you go into the forward bend to protect your back. Take a deep inhale. Exhale, engage your abs, and you're going to bend the knees as you come into a forward bend with a nice long spine. At the bottom, let your torso rest on your thighs and your head hang. And then to come up, you're coming up with a long spine, so your upper back is coming up in a bit of a back bend. Beautiful, Sherry. See how she lengthens that upper back? She comes all the way back up. Good. Then exhale, abs in. You're going to come all the way down. And now we're going to work on strengthening by coming up halfway. So engaging your abs. With an inhale, come halfway up, really lengthening your spine. Exhale, abs in as you come back down, bending your knees generously. Good. Inhaling, coming back up. And pausing there. Now you have the option to stay there for a few breaths as long as this isn't irritating your back. Abs are engaged very strongly to protect your back. And then with your next exhale, you can come all the way down. And then to come up, you're coming up with a long spine, so your upper back is coming up in a bit of a back bend. Comes all the way back up. Next we'll do Chakravasa, which is a flowy cat-cow to bring circulation throughout the whole spine. You want to have your knees hip-width apart and your hands shoulder-width apart, spreading the fingers nice and wide so that your whole hand takes the weight. As you inhale, slightly bend your elbows, draw back on the palms and curve the spine as you come forward, lifting the tailbone and looking up. Exhaling, drop chin to chest, round your low back. Release the elbows to the floor and then the hips towards your heels, only as far back as is comfortable for your body. Inhaling, coming forward again, gently looking forward. Exhaling, drop chin to chest, engage the abs. Release the elbows to the floor, hips towards heels, and let your neck relax completely. Good. Coming forward again on the inhale as you draw back on the palms. Exhale, belly in to engage your abs. Release the elbows and then the hips. We'll do 3 more repetitions. Drawing back on the palms as you come forward. Exhale, belly button to spine as you release back, elbows and then hips. Coming forward again on the inhale. Exhaling, rounding, really articulating the movement of each vertebra. And then last one, coming forward again on the inhale. And exhaling, rounding and releasing back and resting for a moment. From here, I'd like you to come forward onto your tummy. I'm going to have you bring your arms by your side so you're not tempted to cheat and use the strength of your arms. This is to increase circulation into your low back and stabilize the SI joint. So to begin, gently press your pubic bone into the ground. Legs can be hip-width apart. You might play with the align because it might feel better to have your legs together or to have your legs about 1.5 feet apart. Whatever serves you is going to be the best. So we'll do this. You can do this 3 to 6 times. We'll go ahead and do it 6 times. And then you're going to hold the position for 3 to 6 breaths, always coming out when you need to. So to begin with, press your pubic bone down. As you inhale, engage your abs and lift up head, neck, and shoulders. Exhaling, coming down, really feeling your abs engage against the floor. Inhaling to rise up. Exhaling down. This will strengthen your erectors in your spine. Inhaling to come up. Exhaling down. Really use your core muscles. Inhaling to come up. Beautiful. Exhaling down. Inhaling to come up. Exhaling down. Now we're going to inhale to come up and hold this for 3 to 6 breaths. Drawing the shoulders back away from the ears like Sherry is. This will really help strengthen your back. In the beginning, don't push it too much. If you need to come down before 6 breaths or even after 1 breath, please do so. And then Sherry will come down when she's ready. Good. From there, bring your hands underneath your shoulders. We're going to press up to all fours. And then rather than child's pose, I'm going to have you come onto your back and draw the knees into your chest, just so you don't have weight on your knees. This pose is called Apanasana, and with SI joint issues, we want to keep everything symmetrical. So we're going to do both legs at once. You're going to lift one leg up and then the other. And you can place your hands behind your knees. That might be less painful than holding in front of your knees. Lower legs can just relax. As you inhale, let your arms straighten and your belly soften. And then as you exhale, initiate the exhale by drawing the belly in from the pubic bone all the way up to the belly button and then onto the rib cage as you draw those knees in. Inhaling, straighten the arms, relax the belly. And then exhale, abs in as you draw those knees in. 4 more times, nice and slow. Exhaling, really working that core, zipping it up. Inhaling, softening from the top down. Exhaling, drawing the knees in. Good. This really increases circulation to your low back. Good. Now with this next exhale, draw the knees in and hold that stretch for 6 breaths. If you want to intensify this, you can keep the knees in at your chest and press your tailbone gently towards the floor. Okay, now you can gently set one foot down and then the other, always moving one leg at a time to protect your low back. And now we're going to do a twist, and we want to keep your knees hip width apart. So you can use a folded towel, or we have a block. Sherry's going to put a block between her knees. And then with an inhale, bring your knees up into your chest. Arms will go out to the side. And as you exhale, let the knees go over to the right, and you're going to gently look to the left. And I'm going to have you pause there. And you're going to stay here for 9 breaths. I'm choosing not to have you move in and out of the twist because I just want you to focus on letting the relaxation happen. You can work that left shoulder towards the floor. And this is a good place to really work your core, pulling the belly in, pubic bone all the way to rib cage. And then as you inhale, softening the belly from the top down. If this twist isn't comfortable, you could even place a blanket under your right knee so that your right knee is sinking into that if it's not touching the floor comfortably. Now we want to protect your low back coming out of this, so oftentimes it will feel better if you bring your knee up towards your elbow. So you can bring your knees towards that right elbow, and then with an inhale come back to the center. You can pause there for a moment, maybe even hug the knees into the chest. Doing a forward bend brings your low back to neutral, so when in doubt, hug your knees to your chest. And when you're ready, you're going to take the arms back out to the side, take an inhale, and as you exhale, let your knees go to the left, and then you can look towards the right. And I imagine it feels very different on each side. Regardless, wherever you're feeling the tension or the tightness, you want to imagine that's where your lung is, so that each breath that comes in is bringing light and space into that area that's tight. Then when you're ready to come out, you're going to bring the knees a little bit up towards that elbow, and with an inhale, come back up. Hug the knees in. You can set your block to the side. Always feel that to work towards symmetry, if there's a big imbalance, you can stretch the tight side, stretch the other side, and then go back and stretch the tight side again to work towards symmetry. next pose is Supta Baddha Konasana. And this is very healing for the low back. It increases circulation to the whole pelvic area. It's also therapeutic for the knees because it strengthens the adductors. What I'd like you to do is bring your pubic bone gently towards your belly button so the low back is flush towards the floor. Take a deep inhale and then exhale as slowly as possible as you very slowly move the knees halfway together. So notice how we can hardly even tell Sherry's moving. That's slow. Once you get to halfway, you just pause. Take another inhale, and then exhaling very slowly the rest of the way together, really taking your time. Once you get to the top, the feet can rest flat. Pause for a moment. We're going to do that 2 more times, slowing it down a little each time. This time we'll come together in thirds. So opening the knees, soles of the feet together, pubic bone slightly towards belly button. Take a deep inhale. Exhale very slowly as you bring the knees 1/3 of the way together. Another deep inhale. Exhaling very slowly to 2/3. Another deep inhale, and you'll exhale slowly, coming the rest of the way together. Very common for the legs to shake, so don't be alarmed if that happens. Resting at the top. Okay, last one. This time we're coming together in quarters, so you're barely moving. Soles of the feet together, pubic bone slightly towards belly button. Take a deep inhale. Exhale very slowly, coming 1/4 of the way together. Another deep inhale. Exhaling very slowly to 1/2. Deep inhale. Exhaling slowly to 3/4. Good, and then last one. Deep inhale, and as you exhale, very slowly come the rest of the way together. This is a good Band-Aid pose that you can do anytime you're having low back pain.
And it's good for your patience.
This next pose is a gentle back bend to increase circulation around the low back, and we want to really articulate the movement of your vertebrae. So what you'll do is move on exhale so that you can really hollow out your belly, and it's like you're pressing your spine down into the floor, and I'm not going to have you come all the way up to your shoulders because we just want to work with the low back. So you're on your back, feet are hip width apart, only comfortably close to your bottom. You can move your feet, both feet, a little bit further away. Take an inhale, and then as you exhale, engage your abs, and you're going to peel the tailbone up, and then peel up each vertebra in the low back. Pausing around mid-back, take an inhale to stay, and as you exhale, lower back down 1 vertebra at a time. And notice the more you engage your abs, you can really articulate each vertebra touching the floor as you come down. Inhaling to stay, and then as you exhale, really engage your core and peel your back up. Inhaling to stay, and then exhaling, rolling back down very slowly. Good. Inhaling at the bottom to stay, and then exhaling, peeling back up. You're keeping your knees right over your ankles, just like Sherry is. Inhale at the top to stay, and as you exhale, lower back down. We're going to do 3 more. Sherry has hers in alignment, so if they start to come to the outside, you can place a block between your knees. might feel good at the end of that to draw the knees into the chest, just to bring your back to neutral. And rest for a moment. Remember not to push yourself. If this creates pain, stop at just a couple repetitions or stop altogether if it's very painful. And remember, just an inch or two is fine. You don't have to come up super high. We just want to increase circulation around the low back and that SI joint. Okay?